Okay, so sekarang kita akan cakap pasal COVID-19 dan COVID-19 ialah penyakit dia dan kuman dia ialah SARS-CoV. Okay, COVID-19 and SARS-CoV. So coronavirus adalah sejenis virus dan dia dinamakan corona because it's got a spike-like surface macam crown. Okay. Coronavirus has been around since 1960. It's not a new virus, tapi dia ada banyak jenis coronavirus dia. Kita ada coronavirus that can cause mild infection, flu-like infection macam coronavirus 229E atau OC43, NL63 dan HK1. Tapi ada juga coronavirus dalam beberapa tahun ini yang membawakan penyakit-penyakit yang severe, iaitu SARS-CoV, which causes SARS, MERS-CoV, which causes Middle Eastern coronavirus, dan juga sekarang kita ada COVID. So, macam mana, how does this virus spread? Dia boleh spread melalui droplet, iaitu droplet maknanya dia daripada titisan when we sneeze or we cough, the droplets can be transmitted to the person in front of you. Dia boleh melalui aerosolization, katakan kita buat procedure aerosolization seperti intubation, tracheal aspirin, that's what we mean by aerosolization. But the main mode of transmission is through droplet and also contact, which means touching of contaminated surfaces when touching your eyes, mouth or nose. So this is a gambar raja menunjukkan macam mana kuman ini boleh merebak. Bila seseorang itu bersin atau batuk, droplet, which is lebih daripada 5 micron tu, akan will be transmitted onto surface. Dia boleh jatuh atas permukaan macam meja atau katil atau tangan. Dan kalau seseorang itu sentuh permukaan ini dan kemudian sentuh muka dia boleh dan hidung atau mulut, penyakit ini boleh merebak juga. So dua cara iaitu droplet dan contact. Apa maknanya droplet dan contact? Droplet dengan airborne. Banyak orang risau pasal airborne ini. Droplet ialah macam saya beritahu tadi, kalau droplet biasanya dia lebih berat, dia masuk ke dalam titisan air yang lebih berat dan jatuh lebih dekat dalam 1 meter. Manakala airborne dia akan lebih kecil dan it can disseminate in the eye. Macam tuberculosis ialah airborne, influenza ialah droplet. So COVID pun adalah sejenis penyakit droplet macam influenza. Tapi if we do any procedure macam intubation, dia ada airborne. So incubation period, apa itu incubation period? Untuk penyakit ini ialah 14 hari, it is 14 days incubation period. Maknanya dari hari yang kita kena expose sampai masa tanda-tanda gejala ini timbul, maknanya incubation period. Sebelum tanda gejala ini timbul, 1 atau 2 hari sebelum gejala timbul, seseorang pesakit itu boleh mungkin tak akan ada apa-apa tanda. Dan masa itu dia mungkin sudah ada virus dalam badan dia. Tapi pada masa ini infectious period maknanya the period where a patient is able to transmit the disease to others. And most of the time the infectious period is during the symptomatic period, whereas pre-symptomatic period maknanya the time before tanda-tanda gejala datang, the risk of transmission is thought to be very low. Tanda-tanda COVID-19 is fever, dry cough, fatigue, maknanya rasa lemah-lemah sikit, lesu, batuk kering atau boleh batuk berkahak, susah nafas, badan sakit tekak, sakit kepala, loya, muntah, dan juga setengah orang ada juga komplain pasal cerit-berit sedikit dan juga anosmia, mana dia tak dapat hidu apa-apa, tak dapat hidu atau bau sesuatu. Bila seseorang ada tanda-tanda itu, must have a high index of suspicion dia mungkin COVID. So kebanyakan pesakit akan ada tanda-tanda mild disease macam flu dan flu virus, dan mereka tak tahu dia sangat, dan kebanyakan orang akan ingat dia ada flu. Tapi segelintir 10% akan ada tanda-tanda yang severe yang perlu hospitalization, dan daripada ini 5% akan adalah critical ICU. Kebanyakan orang akan recover dan segelintir pesakit akan ada kematian. Kebanyakan orang yang ada severe disease ada kematian adalah orang yang lebih tua. Daripada graf yang ditunjukkan di sini, orang yang lebih daripada 70 tahun, yang orang yang ada sakit jantung, cardiovascular disease atau diabetes atau chronic respiratory disease, mereka adalah lebih boleh dapat penyakit yang lebih teruk. Ini adalah sejak Mac 25, 2022, kes baru adalah 172 di Malaysia dan jumlah kes adalah 1,796 dan kematian adalah 19. Kalau perlu maklumat yang terkini pasal mengenai keadaan di PPUM, semua staf di PPUM boleh masuk UMMC portal untuk mendapat maklumat yang terkini pasal mengenai kes-kes COVID yang dirawat di hospital kami. Jadi untuk mengatasi masalah ini, PPUM sudah ada satu task force yang bekerja untuk membuat persediaan untuk mengambil langkah-langkah untuk merawat pesakit COVID dan juga untuk mencegahi daripada penyakit ini merebak di hospital. So, apakah tanda-tanda or what is the infection prevention and control measures di hospital? What must we do? One is prompt identification. That means we must find out which patient has it quickly. Number two, we have to use the proper PPE or personal protective equipment. And number dua ialah bila kita dapat satu case yang probable or confirmed, we must be able to manage it properly. And then kita buat contact tracing to find out who has the disease to prevent further spread. So di hospital kita buat case definition because we want quick identification. Kita akan cari, kita ada dua definition, satu PUIA, satu PUID. PUIA ialah semua orang yang ada tanda-tanda gejala yang kita beritahu tadi, dan dalam 14 hari yang lepas mereka pernah pergi travelling atau they live in a locally transmitted area, dan sekarang kat Klang Valley atau dekat PJE is one of the hot areas. Mereka pernah pergi untuk cruise atau masuk kapal terbang, dia pernah masuk, ada mass gathering. Baru-baru ini kita tahu ada banyak mass gathering di negara kita yang menyebabkan kluster-kluster penyakit, dan semasa seorang doktor mengambil history, mereka akan tanya, they will ask whether you have been to any of these mass gathering, and also if you have a close contact with COVID, you will be under PUIA and immediately investigations will be taken. So what is a mass gathering? A mass gathering has got many definitions. According to CDC, kalau lebih daripada 50 orang. Tapi CDC recommends that all events should be postponed or cancelled at this point. Whereas in Austria pula, it says more than 6 people. So in Malaysia, I think we take about 50 people. But right now, we shouldn't have any gathering. I would say more than 5 person is a gathering. So jangan ada apa gathering. Okay. So what is a close contact? Ini adalah soalan yang selalu kita tanya. So a close contact, kalau di hospital, is someone that has been exposed in the last 14 days. I mean, 2 days, 48 hours before and 14 days after the. A close contact is one who experienced one of the following within the last 14 days. 2 days before the onset of the symptoms, all right? So this includes a healthcare worker who has been exposed and not wearing the proper PPE, meaning they were not wearing their face or they were not wearing their face mask, or they were not wearing the gloves during the examination of the patient, or they were doing an intubation, they were not wearing N95 mask. It's also someone who stays in the same house, sharing the same bathroom, or have been working in the same classroom, or someone has been face-to-face contact with a person that is less than 1 meter for more than 15 minutes, have been in the same cruise ship or the same household or direct contact with a confirmed case. So for a confirmed asymptomatic case, the period of contact is measured at 2 days before through the 14 days after the date the sample was taken. Right? So that's why kita kata yang sebelum tanda gejala itu bermula, 2 hari sebelum itu ialah the patient might have been already shedding the virus. So we also have PUIB, maknanya setiap orang yang ada community acquired pneumonia tapi ada no history of going to mass gathering or travelling in PPUM, mereka juga akan di-screen atau they be cohorted kepada ward atau bay yang lain and screen untuk pastikan mereka tak ada. So as sudah we said before, very important for early recognition, source control, pakai PPE dengan betul, and to prevent further transmission of infection. So di setiap tempat di PPUM, kita sudah ada screening questionnaire. Ini sepatutnya kita ada roll call untuk setiap ward atau mana-mana tempat yang you ada before you mulakan kerja, TL or head of department or the consultant of the ward, we have to have a roll call and ask semua healthcare worker in the last 2 weeks, do you have any symptoms of fever, cough, sore throat, or any exposure with going overseas, going to mass gathering, have you had any contact with confirmed cases? So if you even have the slightest tanda sakit tekak signifikan demam, immediately put on the mask and inform your TL about it. Always perform social distancing, maknanya tak payah rapat-rapat lah kita 1 sampai 2 meter jarakkan di antara satu sama lain pada setiap masa. Bila ada kat clinical area, please put on a face mask. If you're with your patient or with your friends, please put on a face mask when you are in your clinical area. Always perform hand hygiene. Before you touch your face, you must perform hand hygiene. Before you touch the patient or don your PPE, you must do your hand hygiene, and after touching and removing your gloves. Always clean your equipment, whether it's your stethoscope or the Rappler machine or the BP set. Clean it after each patient, whether it's a COVID patient or not COVID patient, because this is standard care, and we'll never know, and we have to take this precaution for every patient. Right? And your examination surfaces should also be wiped down after you see every patient, irrespective of whether they're COVID or non-COVID. What is a personal protective equipment that you need to use? Personal protective equipment is very important because it prevents the transmission of infection. So for example, this infection is transmitted by droplet and contact. So it's very important for you to wear a mask, and if your patient is also coughing, give your patient a mask, and you should always wash your hands. You should avoid crowded areas and always wash your hands when you come in contact with any surfaces in the hospital, even doorknobs, or when you press the lift button, always wash your hands. And when you go into a patient's room, you must apply the proper PPE, either droplet if it's routine care, and airborne if you're doing a procedure like intubation. So by doing all this, you will protect yourself, your family, your colleagues, as well as your patients. So all healthcare workers in PPUM will be trained to don and doff their PPE. So for all patient interaction, you must perform hand hygiene, you must wear a surgical mask. This is very important. If your patient has a respiratory symptom, please give your patient a mask to wear as well. If you're very suspicious that your patient may have COVID because of the history they gave, and they said they went for a mass gathering, they come in contact with someone who's possibly has COVID, immediately give that patient a mask, and you should wear a full PPE, which includes face shield, face mask, your gown, and gloves. Right? If the patient is very high risk, they're coughing and they're intubated, you can't give the patient a mask, then you have to wear an N95 mask instead of a face mask. If you're doing an aerosolized generating procedure, then you must use an N95 mask, a face shield. You should cover your neck and a gown and apron, gloves and boots because you're worried if there is spillage. Otherwise, you don't need to wear this whole thing because, as mentioned, this is a droplet infection. If you were to wear a face mask and you do your hand hygiene frequently, in a general condition, you would prevent the transmission of infection. These are some of the aerosol generating procedures that will require N95 mask: bronchoscopy, tracheal intubation, using a BiPAP machine, cardiopulmonary resuscitation, and also suctioning and induction of sputum. So how are we doing tests for COVID? We do a PCR test, and this is done by taking a sample from the nasopharyngeal sample. So a doctor or a nurse who's been trained will put a swab into your nose, your mouth and your nose, and will take a deep sampling of a swab, and they will send it to the lab to be processed. Okay, and when someone is doing a nasopharyngeal swab, they will also take put on the appropriate PPE to prevent the transmission of the infection. What is very important, as I mentioned earlier, to prevent this transmission is there's two ways. One is droplet. You wear your mask and hand hygiene. But the other one, because it's a droplet, it falls on the surfaces and surfaces get contaminated. According to studies, these organisms can stay on plastic for 5 days, aluminium for a few hours, gloves up to 8 hours, steel for 48 hours, wood for 4 days, and glass for 4 days. Therefore, if you take care of a patient or a loved one who has this disease and the surfaces are not wiped down, but you put a mask, you will still not be able to protect yourself. So it's very important that you also wipe down the surfaces properly after each patient, whether it's COVID or non-COVID, to keep our hospital safe. These are some of the COVID wards in this hospital. You will know if you work in this hospital. So So we won't go on to the next, but we also, as Prof. Adiba said, for patients who a healthcare worker who have been exposed by a patient who came in and we did not know the status initially, there's risk assessment done by various departments, that is the OSH, the JKA, the infectious disease, infection control department, and a whole load of people will do a risk assessment, contact tracing, and swabbing to isolate and quarantine those who need to be and give the appropriate advice. So just to let you all know, this was a paper by Singapore, which was talking about their experience keeping coronavirus from infecting healthcare workers. It was just published in March, and they say that in Singapore so far they didn't have a single recorded healthcare related transmission because what they practiced was very stringent environmental cleanliness, hand hygiene, and making sure you at least wear a face mask when you come in contact with your patient. So proper hand hygiene was one of the most important things that they attributed to this. I think, so for more information, if you are a UMMC staff, I know many people ask, what's the guideline, what's the latest information. So on the portal, we are uploading all the latest information, links of looking at guidelines elsewhere. We have the KKM guideline, we have CDC guideline, we have WHO guideline, we also have PPUM guideline. We have videos for you to look at how PPE is done and job, and the numbers that you can call if you need any help, like if you think you've been exposed, there's a number for OSH. If you need any advice, the numbers are there. So please open this and have a look to get further information.